There really isn't a particular age distribution for injuries. Anybody at any time can get hurt.
So if you have an injury of some sort and then you have pain in that joint after the injury, if the pain is severe, you should go see someone right away. If it's a little mild pain and you don't have any alteration in the way that you walk, it hasn't made you limp or anything like that, hasn't made you unable to feed yourself or brush your hair if it's in your upper extremity or arm, then you can usually kind of rest, relax, maybe put a little ice on it and see how it does over the course of a week or so.
Ice will tend to decrease circulation and reduce swelling. Heat is good when you have something that's bruised and it chronically bothers you and you want to increase circulation.
If you don't have any reason that you medically can't take an anti-inflammatory medicine, then you could take something like ibuprofen or naproxen, which is an anti-inflammatory. And if you kind of take that and it can decrease the pain, then you usually don't need to come in and see anyone. A lot of minor sprains get better without any sort of medical intervention. That's the wonderful thing about the human body, is it usually takes care of itself.
And we talk about being aware of your body, listening to your body. Certainly if you're doing exercise and you feel like something's hurt, be smart and stop. Ask for help. Use your cell phone. Call a friend to help take you home if you're far away from home. When you have a pain that doesn't go away, you know when you get a bump or a bruise and it goes away in a couple of days, you know you're fine. But something that lingers, it doesn't go away, it continues to bother you. How long? Half a week to 10 days. And intuitively, you know it's not going in the right direction. That's when it's important to seek help. When in doubt, do too little rather than too much. Know when to seek help, when to ask for advice when something's not quite right. And if you err on the side of anything, I always tell people that you want to do a little less and feel like you could have done more, rather than to do too much and say, oh, I'm not doing this again.